So we look at everybody as individuals. So everybody has a different journey through this. And so the common question is, how long before I say I want to have an operation to when I get it? And the answer is it's different for everybody. The shortest might be 3 months. We've had people in the system for a year. Okay? 2.5. Well, insurance is important too. Insurance will dictate many of the terms of what you're going to be able to do or have or whatever. Some insurances require that there's 6 months of medically managed weight loss, which means you got to be in for 6 months at least. And if you've already been with your doctor and have been talking about weight loss, etc., for that amount of time, and they've been documenting your weights and doing it, that counts. Some insurances might say that if your body mass index is over 50, you shouldn't have a band, or if it's less than 50, you shouldn't have a switch. The insurance companies, they just want their bottom line to look okay. So they come up with things that make no sense, but create hurdles for you to jump over. And the bottom line is they know that a certain percentage of people aren't going to jump over those hurdles, and they're not going to try and get surgery. The interesting fact is that the cost effectiveness of surgery for weight loss pays for itself in 1 to 2 years. You can imagine if someone has diabetes, they're on 3 or 4 medicines, and high blood pressure, and sleep apnea, and other things, the medical bills per month that their insurance companies pay for medicines far outstrips the cost of a procedure. However, remember, insurance people are numbers people. They know that the average person stays in an insurance company about 2 years. So if they have somebody go through an operation, the insurance company doesn't benefit from that, because the person usually leaves their insurance company in about 1 or 2 years, and the other insurance company does benefit from that person's insurance company already paying for the surgery. So before we get upset at insurance companies, realize that their job is not to make us happy. Okay? Our job is to try and help you lose weight, medically or surgically. And we will work with your insurance companies to do that. But the insurance companies play their game, and they change rules every 3 months sometimes. So it's very, very important that you check with your own insurance company as to what it is that they cover as far as procedures go and what their rules are, so to speak. We had one unfortunate situation where someone came all the way through and their insurance company didn't cover at all, or
at all.
and
They never checked, they assumed.
and we try and help people with that. That was obviously something that slipped through our cracks, but also it was a rare insurance that we don't see much of because
There was somebody who started without insurance, I believe.
and then switched insurances. Okay, so please do a little homework and find out what your insurance companies will say and allow and all that type of stuff, and that'll help you when you realize, okay, I've got to do that stupid thing. I got to color my hair red or whatever it is that month that they want you to do. Other common questions: will I lose hair if I have weight loss surgery? About 30% of people will have some hair loss when they lose weight quickly, and it's not necessarily because that person's doing something wrong. We always say, look, get as much protein as you can after surgery and all that type of stuff. But the truth is there's a lot of hormonal shifts. And if you think of the body like a ship or an airplane or something, and the plane's going down, they start throwing cargo off the plane, type of thing. The body goes, whoa, we don't want to lose weight. There's something wrong. And it's going to make you, why don't you lay down and go to sleep for a couple days and not expend any calories until we figure out what's going on. So it makes you feel tired. And it goes, why are we growing hair and nails right now? Let's just leave the hair and nails department, cut them from the budget. And so you will have, some people will have some hair loss, but usually that stops and gets better and grows back as the weight loss plateaus. Some people do have what's called alopecia, or hair loss that stays, but it's not very common. The hormonal shifts I'd like to talk about again too is pregnancies. People can get pregnant when they even haven't been having periods for years per se. Okay, we've seen it. Because, and or if they're on birth control pills, because the hormonal shifts that affect with weight loss will render birth control pills irrelevant. And we've had people who came in and look, I hadn't had a period in 3 years. all of a sudden they're having their period and they're pregnant, and they go, I don't know how this happened. I don't either. So obviously, if you think about it, we don't want somebody to be trying to grow a little baby inside while they're losing a lot of weight. It just doesn't make good sense, because the body is trying to throw off cargo, if you know what I mean. We've had that. We haven't had any major problems with babies having, illnesses and or being born prematurely, etc. They all been healthy, but still it's a scary thought. We don't want people to get pregnant in the first year. Can people have babies after they've had weight loss surgery? Yes, and they have healthier babies and they have healthier pregnancies, and that's well documented in the literature. So we suggest the barrier technique, either condoms or diaphragms, etc. If you have ovaries and a uterus and are sexually active. I haven't seen someone get pregnant without a uterus with bariatric surgery. But I'm sure we'd be blamed for it if they did. Smoking, thank you. So if we're going to try and take care of the number one preventable cause of death, we also want to take care of the number two preventable cause of death, which is smoking. So if people are smokers, we implore and ask them politely to stop, because they're not going to have an operation until they've been off ciggies for about 8 weeks. And we do check urine. Not that we don't trust people, but I did have a patient who brought in someone else's urine. I did. She was in the ICU for about 6 weeks with a pneumonia. So we don't want to do things that hurt you, okay? And doing a major operation on somebody who's a smoker puts them at increased risk that we don't feel is a smart or nice thing to do to that person. So if you're a smoker, you're now an ex-smoker. Think of it that way. You're an ex-smoker, whoever's a smoker here.
His face is clean shaven.
Oh yeah, men, we gotta shave our beards, and this is why. When we have people go off to sleep for surgery, their muscles completely relax. And when we're heavier, our palate collapses and forms an obstruction, if you will. And so we kind of breathe for them with a mask on their face. And there's the seal of the mask on the face isn't good when there's hair there. And the most important part of an operation is making sure someone's airway is safe. And so we have them shave just before surgery, and they can start regrowing their beards the day they shave. If you know what I mean. So that's a good point. Thank you. Other questions that are frequently asked, and then we'll let them think of questions that we haven't heard. Okay.
Excess skin.
Okay. Excess skin. Some people will have excess skin once their weight is gone, and that skin. People come in with excess skin on the arms, let's just say, and someone will say, I've been going to the gym and trying to work out, and it won't go away. I'm like, well, it's just skin. You can't work out skin away. And if you had to fill it, make it taut again with muscle, you'd be like Arnold Schwarzenegger, and that's not really something that you're looking to do either. So the only real way to get rid of skin is to remove it, and that's done surgically, and we do that here. And some insurances will cover it, but again, insurance companies are not your friend. They don't care if you don't think you're pretty and all that stuff. Some insurances will cover it if it's medically necessary. And we've played that game for years where we write a letter of medical necessity saying they've had infections and yeast problems and this and that and the other thing, and we send pictures, and then they say, oh, no, we don't consider that medically necessary. Well, then what do you consider medically necessary? Well, if you've been in the hospital for 10 days of IV antibiotics for an infection there, twice. Really? Mm-hmm. So, and if you're looking to have skin excess removal and paid for by insurance, if you call the insurance company and ask them what their medical necessity list is, they won't give it to you. They just don't. So,
How come you can't have sugar afterwards, especially if you have the Roux wine?
Oh, sugar. So there's this thing called dumping that can happen in some of these procedures. And specifically the Roux-en-Y gastric bypass. So when we eat food normally, pretend these X's aren't here. We eat food, the food stays in the stomach because that little valve at the end, the pylorus, and the stomach pushes fluid into the stomach and what's the word I'm looking for? Reduces it.
Mixed kind.
Yes, but the word I'm looking for is
Dilute?
unconcentrates it. Dilutes, thank you. Survey says dilutes. So it dilutes it up and everything, and then when the food comes out and gets down the intestinal tract, it's spit out with this kind of milky fluid, essentially, called chyme. And this, the intestine is used to seeing. The intestine isn't used to seeing food. So sometimes if we eat food with a higher sugar or fat or salt content, the intestine tries to do what the stomach does, is try and put fluid into the intestinal lumen to dilute it. And that can cause significant nausea, abdominal bloating, pain, backache, sweating. You feel like hell for like an hour or two. That's called dumping. Dumping is our friend for a lot of people. And I worry when someone comes in and go, oh, I'm kind of bummed out. Why? What's wrong? Well, I don't dump. What do you mean you don't dump? Well, I was having some chocolate bar the other day and I don't dump. So the ones that do dump, they're like, oh, I'm not doing that again. So you see how it's our friend. If people do dump, they don't go near that stuff. And the ones that don't, well, they do go near that stuff. Which kind of goes to show you, these are all tools. These tools are very effective. They're awesome tools, but they don't do the work for you. It's like a lawnmower. You can have the best rider lawnmower in the world. If you don't get on that thing and mow the lawn, that grass is going to grow. So it's a tool that we use every day. And so some people, when they've lost their weight and they feel good for 3 or 4 years, and I don't really need to. And they go back to high liquid calories, which can go right down that roux limb and start being absorbed, etc. With the malabsorptive procedure, that's tougher to fail because you have a short landing strip either way. So I'm creating a short gut in that person. But still, these are not 100% effective. They are for a lot of people, but across the board, you'll have still failure. That was a good question. What's the other question? We'll let them start firing away. Do you guys have any questions that we haven't answered, that of anything behind me or not behind me? Or
Does the poop really stink bad? Poop really stinks bad after bypass surgery, just so you know.
Just so you know.
I know firsthand.
I do that. That's what I was just gonna say.
And you look great.
I do. Thank you.
And when was your surgery?
4 years, 9 months
4 years ago, 9 months.
152.
God bless you. The 4 major bariatric surgical procedures done here at Adirondack Medical Center are the duodenal switch, the Roux-en-Y gastric bypass, the laparoscopic band placement, and the sleeve gastrectomy. The bariatric surgery with the lowest risk is the laparoscopic band placement. The bariatric surgery that has the highest risk would be the duodenal switch. The bariatric surgery with the highest failure rate is the lap band placement. The bariatric surgery with the lowest failure rate is the duodenal switch. Thank you for taking the time to watch that bariatric information session. If you have your questions all answered and you're interested in talking to me and or the bariatric center itself, please call 897-2531 in area code 518.